Hello, my name is Lillian Agbeyegbe. I'm glad to welcome you to another episode of Your Public Health Professional and You, a program of the Maryland Public Health Association. Today, we're having our Maryland Public Health Association directly related guest, and we're very excited because one of our students said, you should talk to my professor, Dr. Jillian Fry. Thank you for joining me today.
Thank you so much for having me. I'm really happy to be with you.
Great. So we wanted to get to know you. I know your name, I know you're a professor, but tell us a little bit about yourself. Who are you and what exactly do you do?
So I'm an assistant professor in the health sciences department at Towson University. And I'm also the program coordinator for our undergraduate public health program. And my research focuses on how we can shift the typical American diet away from being so high in animal products, specifically meat and dairy, to eating more plants, more plant-based foods, more plant-based meals. And the wonderful thing about looking into how to make this change is that there are health benefits because Americans typically have very high intake of animal products, much more than we need. And so it's better for our health to eat more plants and fewer animal products. And it's also better for the environment in many ways, climate change, water, et cetera. And then a big focus of my work as an assistant professor here and as the program coordinator is I teach courses to our public health undergrads, mostly other Towson students as well, and serve as an advisor. And I am preparing our students to become public health professionals out in the world. And that's one reason that at Towson University, we have been putting an emphasis on linking our students up with the Maryland Public Health Association so that they can, they hear from their professors all the time. And most of us have done other things in public health before we've become professors. That's very common in public health. But I also want them to hear from other professionals in the field so they get a sense for all the opportunities and everything public health professionals are doing to protect the health of the public.
Great. That is a very good and extensive introduction. And it gives us two core things I would like us to focus on. One being the fact that you train students, you teach students, undergraduate students, and provide them guidance. And so it's the public health field. And when we hear public health, we're thinking that these people are either medical people. Sometimes people they just hear health and they think hospitals, or they hear public health and they're like, who are those people? So what if you just wanted to say, from your own point of view, what really is public health and what are you training these people in?
That's a great question. And that is a critical question for the field because we're very much behind the scenes. We're focused on prevention. We're focused on reducing health inequality. And one thing that I explain to my students is that we really do need to tell the story of public health. We need to tell the story and get the word out there. And that's why I'm so thrilled that you have this initiative, because when we put things into place, whether it is laws that keep people safe or changing the way roads are designed, or making sure that food and water is safe for us to ingest. When we reduce illnesses and injuries, people don't wake up in the morning in the future and think, boy, I'm really glad that, I didn't get in that terrible car crash that didn't happen. Or I'm so glad that my kids are able to stay healthy with these vaccines and clean water, right? That don't contain pathogens that made so many children very ill, before we had the infrastructure that we have for these things that we really take for granted. So that's one way that I explain it to students, that we have lines on a graph, and we can estimate and we can report the injuries that were avoided, the illnesses that were avoided, the early deaths that were avoided. But it really is a challenge for us to explain how we do that and what the numbers mean. Because when you have avoided a problem from, prevented a problem from happening and lowered the numbers, there's not an actual person in front of you where you can say, this intervention saved your life. Once in a while you can do that, but many times you can't. The human brain really reacts more when it's a very specific person and a specific story. So it is a challenge, but there's also a lot of excitement around the field of public health. The students are excited, and when we talk about shifting our mindset to changing conditions around people, so that not only are we providing information about why it's important to adopt healthy behaviors, but if we change the conditions where people live, so that the easiest choice, right, is the food that nourishes our body instead of food that is not good for us. Or if it's the easiest choice to take public transportation and incorporate walking and that kind of thing. When we talk about how powerful that can be, students really respond to that.
Mm-hmm. That's good. And it's like you said, so when you can't see the one person that is impacting, you're wondering, what have these people done? But I wanted to go to one of the second things you said about your research focusing on the American diet. So there are people, I take it, all over the United States who you would never get to meet, who are going to benefit in some way or the other with this, your research focus area. Now, tell me, how does this work that you're doing, what does it mean for the average American person in the long run?
That's a great question. Continuing with the theme of changing the conditions around people so that we don't even need to think about the decision to eat a diet that has more plants versus being very heavy with animal products. If the conditions around people make it easy for them to do that, it has so many health benefits. For example, in the American diet, because we don't eat enough plants, we don't generally get enough fiber, which is incredibly important for our health and impacts rates of colon cancer and other things. And so I am trying to make my little contribution in this area to get information out and encourage changes so that it's very easy to have a dietary pattern that helps you get enough fiber and get the nutrients that you need. And it's a very interesting question to think about in terms of the people who I'm hoping will be impacted by that, so that it's easier to do that, but who I will never meet, right? That is such an interesting question. The great thing about the field of public health is that we're very good about so many different ways to measure how things are different. So we look at disease rates, of course, but we also have big surveys by the CDC, like NHANES, where we're tracking how diets are changing. And we have really creative methods where we can take a tool and go and look either at a restaurant or at a grocery store, and we can see what is present that is, pushing food that is not so healthy, that we shouldn't eat as much, and what is making it easier to eat food that that really nourishes our bodies. I have also done research where I look systematically at how the media covers some food system issues. So that's a really neat thing in public health, where when we're looking at what does the food environment look like and how has it changed, and how is the media getting information out about these issues, that really gets me thinking about the people who I'll never meet, who are either, reading those media pieces or in a food environment that makes it just so much easier, to get the food that you need. And it's very satisfying to think about that and the positive changes that hopefully have a broad impact.
Absolutely. I go to the store these days and I pick up something and I look at the nutritional facts at the back of the product, and it wasn't always there. And some public health practitioners somewhere worked with the nutritionist and came to pass that policy that it has to be there. Now, I know that even so many years ago, you could go to McDonald's or wherever you went to eat, and you didn't see the calories of the products that you were buying on the product.
Exactly.
Or if you go, I'm talking about going out and now and seeing a fruit market somewhere where I can buy fresh produce that wasn't there and didn't just magically appear, but appeared because some advocates said, there's people in this neighborhood, if we don't bring a mobile food market, even if it is once every month or something to them, they are never going to get fresh produce. And I didn't know those people. So that's why I'm thinking about, you're working now. So maybe next time we go, like you just even said, that people go into the store and to the supermarket, and maybe somewhere down the line, supermarkets are going to be required or encouraged to have this many, less food that doesn't give us fiber. And then you go to the restaurant and you don't have to, it's just there on your menu, and you have the labels that indicate that this food is high on fiber or low on fiber or something like that. And we can make those choices.
Yes, absolutely. You're thinking about it exactly the right way. And the nutrition label is a great example of something that we don't really think about. And especially for my students who are so young, I was telling them that, I'm about 20 years older than them. So I have the advantage of, I've seen policy changes, right? But for college students, they're just starting adulthood. So any types of changes with nutrition labels or calorie counts on menus, they probably never noticed that change. So we've been talking about how policies can be so invisible, because even when you live through a policy change, once you've adjusted to the new policy, that's your new baseline. And so nutrition labels of public health policy, absolutely. They've been around a while, but there was a relatively recent policy fight there about whether added sugars should be required as an extra line. And this is incredibly important for what information is required to be communicated to citizens about, not just food, but reports on contaminants in our drinking water and things like that. So requiring information to be reported and thinking very carefully about how it should be reported because, health literacy and those types of concepts are so important. So it really is something that I enjoy thinking about how, like what is invisible even to public health students about the field of public health, how to make that visible and think about, what do we want it to look like in the future?
Absolutely. That is so, and it's so true that you're saying that, because I know that there's some people who would never know that people used to smoke in restaurant or in offices or things because, the smoking policy had been in place since they've been around, but it wasn't always that way. And
it's a great example.
Exactly. And so you said, you're like 20 years older than your students. So you were once a college student yourself, and you were before then. How did you come into public health? Did you always know when you were growing up you wanted to become a public health practitioner? Did something happen? Did you change fields?
I have really always been in public health. I started my studies at Penn State. I grew up in Pennsylvania, so not far from where I am now. I went to Penn State, and they had an undergraduate major called biobehavioral health. And it's still around, and it really lines up with public health. So it's not called public health, but I was really pulled towards this idea that you want to study, what's going on from a biological perspective, but if you're missing the behavioral context and societal context, that then you really only have one piece of the puzzle. And it's fine to have one piece of the puzzle. Then you have to collaborate with people who have the other pieces. So, but it was basically public health. It just wasn't called that.
Okay.
And it's very common, as I'm sure you're aware, for people in public health to work in different areas of the field. And I really enjoy talking to colleagues and learning about what they've done before. And so I used to I really got my start in sexual health, HIV prevention, and harm reduction, harm reduction for like providing clean needles in needle exchange. And at the time, that was pretty unusual, because it was many years ago. And I got my start with public health practice in college as a peer sexual health educator, which was such a great experience. And I'm really glad that, that universities still do that. And then I worked in HIV prevention and harm reduction for the New Mexico Department of Health. At the state level, and lived out there for a couple of years, and just learned so much being in a state health department. And then went in the direction of food systems and more studies after that.
Awesome, great. Yes, I worked in the field of HIV/AIDS also. When you were talking about behavior and the environment, I was thinking when I was working in New York then was one of those things where there's a lot of focus on providing medical care for people and making sure that they're getting their medications. But we were like, yes, medications are good, but if your client is homeless, there's so much the medication can do for them. If they're struggling with substance abuse issues and they don't have the right food, there's so much the medication itself can do for them. So we have to be addressing these issues, looking at the social determinants of health and all of that to make sure that we are looking at the outcome comprehensively. That's very good. So you have students in your class. Do you find that, do you have to encourage people to, I know your school probably has somebody who does the recruitment, but if you yourself were going to recruit somebody into the public health profession, what will be your spin or your word to somebody who's thinking, I don't know, I'm just going into college, I haven't quite decided, and you're trying to say to them, the public health might be an option you want to consider?
A couple of things that I highlight about the field of public health, because I do have students contacting me with a couple of questions that are relevant to what you're saying. Some students say, I am interested in public health, but what do you do? Like, what are the jobs in public health? And I say, fair question. I'll tell you what I can. And then other students just saying, I'm interested in public health, but I don't know yet if I want to major in public health. I think one thing that resonates so much, especially with young people, but it's resonated with me the entire time that I've been in public health, is the focus on social justice. I mean, there can certainly be public health professionals who have a very technical role, and maybe working on social justice is not something that they focus on. But throughout the field, I would say the majority of people in the field are really called to this work. And are called to improve lives for folks, to reduce health inequalities. And there's a really strong thread of working for social justice in the field. And I think that it's something that is very special in public health, and especially because the field over the past several years has really embraced the realities that we need to account for and do everything that we can to address the social determinants of health. And when it hasn't always been like that.
Absolutely.
Yeah. And it gives me real pride and real motivation as someone in the field of public health. And I see myself as an ambassador for the field of public health, especially here at Towson. And then the other part that I talk about is how broad the field is, which can make it a little difficult, for college students to, they really are looking for examples and specifics, like what do people actually do? And so I will highlight for them that you can have certain tools in your tool belt that you really like to use as a public health professional. So you could focus on, epidemiology and data analysis, or you could focus on advocating, for policy change, just as a couple of examples. And then I talk to them about, you might, have a tool that you really like to use, or a few tools. You might want to focus on being a practitioner or a researcher or a mix. But then I also talk to them about if there's a population that you really want to work with and improve health, whether it just really, runs the gamut, whether it's a population or a specific health issue, right?
Okay. Then,
dive into what are the issues, whether it's, a health issue that you just can't learn enough about, right? Like, it doesn't feel like work when you're learning about this issue, or when you're reading about and interacting with this population. Like, it really motivates you. You're really passionate about it. Then just, go in that direction, learn all you can, and how the different tools and essential services, the technical part, how the field of public health applies either to that population that you're very interested in, or that health issue that you're very interested in. And then, we talk about what the jobs, might look like looking at health departments and nonprofits and service providers, and it is quite broad, which is a beautiful, wonderful thing about the field of public health. But it is a challenge, though, too, to explain what it is.
Yeah, it's kind of like a kid going into the toy store, and you have all of these ones. Which one do you take? And you have to be able to narrow it down. Well, that's very useful information you're giving to them. And we've looked at people coming into the profession. Now let's look at people who are in the profession Earlier on, you said you try to connect your students to MDPH, that's the Maryland Public Health Association. And it's a collective of professionals. Now, we have some public health professionals in the state who are not yet members of the association. And so what would you say? Because I imagine that the benefit of connecting your students to MDPH is so that they can get some insight, like you said. But if there are no members here, then what do they come to? So what would you say to public health practitioners who are in the States who are not yet members of MDPHA?
I would stress the importance of being lifelong learners in this field. I think it's very common for people in the field of public health to identify, and behave as lifelong learners. And even if I attend a webinar or I go to an event and I meet some MDPHA members, and the topic or what people work on is so different from what I work on, I always learn something new. And that's it. It's so important, especially in such a broad field, for us to never stop learning. And especially because as public health professionals, if something comes up that, in my community or in my family or with my students, a public health issue where it's not my expertise, I want to be able to bring up cutting edge information about what are good strategies and good information about that issue, which, we all learned in COVID where, a lot of information and we have to be able to tease out, what is the best evidence and then adjust as we move forward. And so I want to know as much as I can about what's going on in the whole entire broad field of public health, in part so that I can serve as a source of information and connect people with resources. So I think it's closely tied to keeping a curious mind and wanting to learn more and, connect with different folks. And if I can help somebody that, maybe is early in their career or is looking for a career change, and we can chat, or if someone, somebody might have advice for me because they've, been in the field longer. So it's very important.
Absolutely. I couldn't agree with you more, even though I am a member. But, we are affiliated to the American Public Health Association, and so we connect with the national body. And I think in a couple of months, maybe next month or so, we're also having a tri-state conference, but we do in collaboration with the Delaware Public Health Association. And I think it's the Philadelphia Public Health Association as well. So really bringing all of those resources together. And like you said, learning from what different people are doing in different ways. Earlier on, you were talking about the focus of social justice. And I was thinking to myself, it was only recently, not too long ago, maybe not recently, but not too long ago. And I remember all the work that went into declaring racism as a social determinant of health, as a public health issue, and really underlining the work that public health practitioners do. Dr. Fry, it's been very wonderful talking to you, learning about your work at Towson University, how you engage students, how their work is coming out to help people. But as I said to you earlier on, we're really trying to humanize public health, for public health, for people who are like, I don't know who those people are. I don't know what they do. And why did they say public? And so I wonder if there's anything else that has crossed your mind along the tangent that you'd like to share with us before we end the interview.
I really just want to express my support for this initiative. It's really, really important. A lot of what we do is behind the scenes, right? We don't see patients one-on-one. sometimes we often meet with groups of people, but sometimes our jobs don't even really involve meeting with groups of people. And so it really can be behind the scenes. Even some of the changes that we work for, they keep people safe, but in a not very noticeable way sometimes. And so it's such a great initiative and such a great idea just to, explain what the field is in different ways and have, individuals explain their work. And I really hope that it's quite successful and people learn from it.
Thank you very much. My name is Lillian Agbeyegbe. I am your friendly community health educator. This is your public health professional and you, a program of the Maryland Public Health Association. You can learn more about us. Go to our website, www.mdpha.org. And yes, we're going to be having another conversation with another guest shortly. So please do come back. Thank you.